The Zika virus has hit the state of Florida. Governor Rick Scott confirming Monday 10 more people have contracted the Zika virus from local mosquitoes. He's now called for help from the Centers of Disease and Prevention. It brings the state's total number of cases to 14, but that number, of course, could well be higher at this point. CTV's medical consultant, Dr. Marla Shapiro, is here in studio with me live. Big news out of Miami, of course. People are worried. How widespread is Zika at this point?
Well, we've seen somewhere between 62 to 63, maybe upwards of 65 now countries reporting this disease, not surprisingly, and we expect it to grow. The estimate is in the Americas alone, North America and South America, by the end of the year, we'll be looking at millions of cases, remembering that many of these cases are often asymptomatic. The big worry is what we've seen with this virus that we've not seen with other viral illnesses, the impact on in utero fetuses, the microcephaly, the neurological disorders, which is so distressing.
Florida, of course, a popular destination for a lot of folks in Eastern Canada
Yes.
throughout the year. Your take on how this is going to play out now?
Well, you know, everybody hears this, and I think there's going to be a big pullback and an impact on tourism. It's not a surprise that we're beginning to see this in temperate climates. We know that this is a mosquito that we do see in temperate climates, we were, I think, waiting to see where it was going to be. There's a number of other places that we've seen it in the United States as well. So what we're seeing here that's different is that these are not cases that have been brought in and person-to-person transmission or a contaminated blood transfusion, which is another issue that we have to begin to be concerned about, people donating blood who may have the virus, but now a local mosquito. Some of the cases that have been picked up in this area that they're looking at are asymptomatic, as we would expect, because 80% of individuals who get the disease have a mild enough case that they may not even be aware that they have the disease.
When we're talking about a travel warning, this kind of advisory, this is the first time in a long time.
Long time, decades that we've seen this type of thing. And it's really focused at women who are pregnant or attempting pregnancy to recognize that exposure during pregnancy is the big concern. For children and adults who have had the disease, in most of the cases, so these are born children after who've had an exposure, we typically do see a mild disease. But this is newly evolving information that we continue to see, learning how long the incubation period is, how long after exposure, if you're planning a pregnancy, you should wait. One of the most common questions that we're being asked right now. And so far what we're saying is if you've been exposed at least a month for a blood transfusion, we're saying 8 weeks for women who've had an exposure, but we do know that you can detect the viral tracking within semen for up to 6 months. So, you know, you begin to get, first we heard 2 years until you should try and get pregnant, wild, types of statements that don't necessarily have scientific backing. But that's the numbers that the CDC and the World Health Organization are now talking about in terms of how long to wait. And again, we're watching evolving science in terms of what we're learning about this disease.
You mentioned the CDC, Centers for Disease Control, based in Atlanta. I mean, these are foremost experts on this kind of stuff. What do you make of them moving in now to try and contain this?
Well, aggressive control is really what you need in terms of mosquitoes, and we've seen that before with other mosquito-borne diseases. And what they're so expert at is not only doing that type of mosquito control, but also making sure that what you're using to kill the mosquitoes is effective with the mosquitoes. We know these mosquitoes themselves do not travel large areas. About 250 yards is the surface of what they go, which is why we see them often in contained areas. But I don't think anyone is thinking that it's only going to be this contained area and it won't have the ability to travel throughout the state. So I think aggressive response, and they're taking this very seriously to contain this, and have been successful with other diseases. But you can hear the level of frustration when you hear CDC health reporters talking about the nature of the disease, the spread of the disease, and the fact that so far the mosquito spraying has not been as effective as they would have liked to see. I'm not sure how general that statement is and what it means, but what it tells us is that, you know, we're watching this and we're concerned as to where it will go next.
Great to have you on as always.
My pleasure.
Thanks for this. Good morning to you.
Good morning.